Meeting is called to order. Roll call, Ms. Griffin, Mr. O'Connor, Ms. Inamorata,
Present.
Ms. Howell.
Here.
Manny.
Here.
And I know Mr. Perkins advised me that he was at a Superior Court argument in Philadelphia and would probably be unable to make it.
Oh, he's a fancy one.
He's fancy. Okay, community corrections reports, passages to recovery.
Good afternoon, everybody. Jeff Williams, representing Passage Recovery. I'm the facility director. Not too much going on at Passages since the last time I was here. Just a few numbers for you. Current number of residents in our facility are 33. The number of individuals have been transported to the hospital via EMS has been 2. Over the last month, we've had 2 cases of COVID, 1 staff and 1 resident. No overdoses, no self-harm or injuries, no use of force. And I think last time I was here, you guys had asked me a question: if someone is revoked, can they come back to the facility if they are revoked or escape? If they are revoked from our facility and returned back to the jail, they can come back and be referred back to the courts within 1 year. And if they escape, they have 3 years before they can come back. Questions?
How many revocations did you have this month?
Revocations, we had 1 revocation.
And do you know what was the reason for that?
Yes. The reason why that person was revocated is because he got into a physical altercation with another resident, and he put his hands on that other individual.
All right, thank you so much.
You're welcome. Well, I forgot to say we had 3 escapes.
Anybody else?
Yeah, you mentioned a couple of people, had to use EMS services.
Yes.
Is there any additional information you could share? Like, do you know if they were admitted or if they returned?
Yes, 1 was admitted. He was in there for about 4 days. He had pneumonia. The other 2 were just there for, one had fell on her way to work, and she fell and injured her shoulder. And the other one had an allergic reaction to some peanuts.
Thank you.
You're welcome.
Thank you.
You're welcome.
Renewal.
Good afternoon, Adam Zach, ZAK, reporting for Renewal Incorporated. We currently have 114 county reentrants in our program. The breakdown is in our work release program, 75 males, 9 females. In our drug and alcohol program, 25 males, 5 females. In the past month, we had 66 admissions and 58 discharges. The breakdown for the discharges are 8 escapes, 12 revocations to the jail, and 38 successful completions. We're currently, our reentrants are currently employed at a rate of 66%, with average pay rate of $16.13. In the past month, there were 7 instances where reentrants were transported to the hospital via ambulance. We had no use of force incidents, no deaths, no suicide attempts or self-harm incidents, no non-fatal overdoses.
Questions? Ms. Hallam?
Yeah, I have one. I'm just trying to find the picture of it. Okay. This is specifically about the Boulevard of the Boulevard on the Allies? Of the Allies? Sorry, Boulevard of the Allies location. So I guess there was a notice sent out, and I have a picture of it, but I'm guessing you have seen this. A notice that was sent out about people asking for travel passes with the upcoming holiday season, both for, it looks like Thanksgiving and this looks like it's just specifically for Thanksgiving. And so it talks about like who's eligible for a travel pass, and it specifically says that if you have one specific parole agent, that you are just automatically not allowed to get one. And I was just wondering if you could speak to why folks would just be off the bat not allowed to apply for a travel pass to be with their family for the holidays.
I can't speak for that. I think you're referring to the state reentrants.
This is for the state reentrants too.
Yeah, I don't deal with the state. I only deal with the individuals from the Allegheny County Jail, and typically they're not afforded any passes during the holidays, Christmas or Thanksgiving.
Oh, so if you are not a state reentrant, if you are a county reentrant, you get no passes for holidays at all?
That's correct.
No matter what the circumstance?
That's correct.
Okay, thank you very much.
Anybody else? Thank you.
Thank you.
Electronic monitoring.
Good evening, everyone. I'm Sarah Manning, representing Allegheny County Adult Probation this evening. Since the last report, since the end of the reporting period, we've had 623 individuals on a bracelet. We have had 57 individuals successfully complete the program, and only 2 were removed for violations.
Questions? Ms. Hallam?
I have a question about violations. If you get like a warrant out for a probation violation, does that like extend past your max date, like when your probation's supposed to terminate?
If you were violated during the terms of your probation, then yes.
Okay, so like, let's say you had a warrant and you're like outrunning the warrant because you know your probation's about to be over.
Right.
You can't do that. Like it will extend past
Once
your.
you are arrested on that warrant, it would still be applied.
So you would basically be on probation for as long as it
Forever.
takes till forever?
Right.
Okay, cool.
The judge could close interest early, but
Okay, is that the same with if you are arrested on a violation before your max date when your probation is supposed to end? Are you, like, you could be extended past that date?
if you're arrested during the period of your supervision, yes,
Okay, so they can add extensions to it because you violated before it was over?
the judge could add extensions
Gotcha,
to it.
thank you very much.
Thank you.
Anybody else? Manny?
Yeah, I just have one. This may be a basic question, but I spoke to someone in the jail who was sentenced to electronic monitoring, but they had a hard time connecting to the house or like the owner of the house that he would be, serving that electronic monitoring on. What happens in that case? Like if they can't, get in contact with the person who owns the house?
Well, they have to be able to get in contact with the person so they can get in and set up the equipment and make sure it's a suitable residence for them to live in. If after a few days or whatever, if they couldn't get in touch with them, they would try to find alternate place for them to live, set up somewhere else.
Okay. I mean, I guess like my ultimate question is, what if there is no alternate place? How long do they remain in jail? Do they get sentenced to something else? You know what I mean?
Well, if after a period of time, if they cannot find a suitable residence for them, we would go back in front of the judge and see if there's another option that could be imposed.
All right. Thank you.
Sure.
Thank you. Okay, next would be public comment on board action items. So we have one action item this evening, which is the approval of the job solicitor bid for posting. So if anybody would like to speak on that issue, you may take your public comment time now. You don't get 2 public comment times, though. So if you want to speak to that issue, you can go now and address anything else you want to address. So if anybody signed up and you'd like to speak to that issue, please come on up and identify yourself.
Why would they not get 2 public comment speaking times with one issue specifics and the other one is general? Because if someone has a general public comment already prepared, and they weren't aware that this solicitor posting was happening, then you have to say about it, then they should be allowed to public comment.
I'm having a hard time hearing you, but the agenda is posted, so you would know. The agenda is a public document, which is posted.
But nobody should have to pick between an official business, public.
You can speak on whatever you want. You don't have to speak 3 minutes on the solicitor. You could speak what you get your 3 minutes.
As long as you mention the solicitor.
Yeah. Okay, anybody? All right, old business. Updates on employee welfare. I think I'm the only committee person here at the moment on employee welfare, and I will say that we did conduct a few more exit interviews. I wasn't here last month, so I'm not sure if Mr. Perkins reported on this, but we did conduct some more exit interviews. We also met with the union representative for the COs, and we intend to meet with jail administration next. Incarcerate welfare.
No update since our last meeting.
Okay, thank you. Health Services Advisory Committee.
No updates. I feel like we did something during the last meeting. I mean, between the last meeting, I'm looking on my calendar, but I can't see what it is. We may have just talked briefly about something, but no report.
Okay,
Yep.
thank you. Lockdown and Use of Force Subcommittee.
Again, we don't have any updates. We weren't able to meet, unfortunately, but we will. We did kind of compile a list of asks for the jail to get into a little bit of specifics, about these issues, of course, but we don't have that yet, and we'll probably follow up via email.
Okay, thank you. Do I have a motion to approve the solicitor bid for posting?
Motion to approve brief discussion.
Oh, yeah, sorry.
Need a motion and a second to start discussion.
I know, I just said motion to approve brief discussion.
Oh, okay, is there
I know,
a
I'm
second?
waiting for a second.
I'll second.
Okay.
Okay, there's a second discussion.
So we sent it out, got responses back, ready to post. I do know we had a little technical wording change that came across. So I guess, can we approve it and then make the amendment, or make the verbal amendment and then post it?
Oh, what is the?
Do you want to?
I feel it's
It was just a technical
non-substantive,
wording.
but I just feel
Yeah.
like it's a language change that clarifies it. So in the section that says how to apply, the item 1, it says a cover letter and a resume, and it says a resume may not be submitted for an application. I think that that's confusing. A resume may not be submitted for an application when we're just saying before that you have to submit a resume. So I think what that's meant to say is that a resume may not be substituted for an application, meaning you can't just give a resume. You have to do a resume and an application. So my suggestion was changing that sentence to read, a resume may not be substituted for an application.
Can I ask something, though? Is there some application form that has to be submitted, or do you just submit? Is there, I don't see an application anywhere.
Oh. I
Do
was
you
assuming there
follow
was an
me? I mean,
application.
applications will be accepted, so when somebody goes to apply for this job, is there some county application
Yes,
form?
yes,
Okay,
yeah.
okay, thanks.
So I would just, if everybody's okay, we would just second your verbal amendment, make the change, and then we could go back to the now changed application and vote on it.
Okay, so we have a motion on the floor to change the second sentence of number 1, a resume may not be substituted for an application. Does anybody second the motion?
Second.
All in favor?
Aye.
Anybody opposed? Motion carries.
Okay, now the actual motion, just thank everybody for their responses. We'll make the edit and get this posted.
Okay, so we're going to vote now. All in favor?
Aye.
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 Any opposed? Motion carries, and we will post that job. Okay, Warden's report.
Good evening, Board.
Good evening.
Good evening. We were pleased at the jail to welcome the National Commission on Correctional Health Care back to the facility last week. The NCCHC was here for 3 days as it completed its accreditation survey. NCCHC staff members complimented medical and correctional staff and noted the impressive camaraderie between the correctional staff and healthcare staff. Deputy Warden Martin will have additional details in her report. The jail held its voting session for incarcerated individuals last Thursday. We were pleased to have a crew from NBC News on hand to document the process and conduct interviews with staff and incarcerated individuals. We appreciate the opportunity to highlight the hard work that we do in ensuring that our incarcerated residents are aware of their rights and have access to the voting process. Deputy Warden Clark will have more in her report. Finally, I want to acknowledge that this is my last Jail Oversight Board meeting as acting warden at the Allegheny County Jail. I will be returning to the Pennsylvania Department of Corrections at the end of November. My year-plus serving at ACJ was an incredible experience, and I'm pleased to have been able to not only serve the Commonwealth, but also effect change for my fellow residents of the county. I would like to thank each member of the jail staff who works so hard each day, and I would like to thank the former county manager, Ms. Liptak, and Mr. Pilarski for originally bringing me in as acting warden. Thank you to County Executive Enamorado. You have a unique vision for how you want information to be shared between the community and the jail, and I'm humbled to have been part of your vision and your administration. To the jail administration team, keep your heads up, and I know you'll keep moving forward. I also like to thank the board for working with us by providing oversight of the carceral process. The past year has represented a transition period for both the jail and the Oversight Board. Although our interactions have not been without challenges, I do believe we all want the best for those that we serve, and that is demonstrated by our improved collaboration. If that is the focus, we can only get better from here. With that, I would like to turn it over to Chief Beeson. Thank you.
Thank you, Warden. Good afternoon, Board. Staffing update. Our training academy began its current class on Monday, September 23rd, which consisted of 19 cadets. Currently, that class has 14 cadets remaining. We had 3 resign, 1 was removed for academic reasons, and we had 1 removed for time and attendance issues. The next academy class will begin on Monday, December 16th, and we'll be able to report next month on the numbers expected for that class. Currently, we have 17 males, 5 females awaiting transfer to the PA Department of Corrections. 6 males with detainers, 14 males with open cases. The longest wait time on a 300B was received on September 24th, and the shortest wait time is from November 1st. Currently 23 federal inmates in the Allegheny County Jail, 19 of which are United States Marshal holds, and 4 are federal transfers for Allegheny County Court. We did have 1 individual on a hunger strike for the reporting month, and that individual refused 13 meals. And finally, for my report, I'd like to announce that mental health registered nurse Samantha Amstone and Sergeant Dwayne Larden were named the correctional professional for the month of October, and we'd like to offer our congratulations to both. Deputy Clark will continue the report.
Thank you, Chief. Good afternoon, Board. For chaplaincy and pre-release, Foundation of Hope held its fall volunteer training on October 26th. Approximately 90 volunteers attended the training event. The Foundation of Hope is beginning to prepare for the upcoming holiday season, which includes preparation for the yearly holiday gifts that are packaged and distributed by Hope employees and volunteers. Discharge and release. The Discharge and Release Center assessed 333 individuals and distributed 50 boxes of Narcan, 114 fentanyl and xylazine test strips, 347 condoms, and 311 bus tickets in October. The DRC continues to connect individuals to services in the community. For the month of October, a total of 85 incarcerated individuals received contact visits from 163 family members. Residential placement services. Based on orders from the court, residential placement services facilitated the transfer of 71 individuals to alternative housing and 18 individuals to substance use treatment through the diversion program in October. The diversion program received 21 new referrals and served a total of 62 participants in October. The medical assistance program assisted a total of 114 individuals with completing medical assistance applications upon release from the jail in October. On October 7th, in partnership with the Allegheny County Health Department, the jail hosted a pop-up resource event. The event took place outside the jail's visitor entrance. Community organizations came to provide information on a variety of resources. Most of the information distributed was for substance use supports and services, as well as mental health and medical services. families coming for visitation, individuals released from the jail, and the jail's program teams were able to participate in the event and learn more about the rich resources that Allegheny County has to offer. Today, the Trinity Takeout program began. This program enables families to order specialty food items for their eligible loved ones, such as hamburgers, chicken sandwiches, and French fries. Families can go to the jail's website for directions on how to order. Educational services. October 9th was the last of 4 voter educational sessions that took place in the jail throughout the fall. October 31st was the jail's election day. A total of 154 incarcerated citizens voted via absentee ballot. With the support of community volunteers and the jail's caseworker team, the jail registered a total of 276 new voters and updated registrations for 155 registered voters. The voting efforts of the Allegheny County Jail were unique. Therefore, news outlets WESA and NBC reached out to us to report on our efforts to educate and register voters. It is our hope that the efforts of our jail will challenge and inspire other jails across the country to improve their voter registration and election efforts. We would like to thank everyone involved for their dedication and support in these efforts, and we look forward to continuing to challenge ourselves to reach as many eligible voters as possible in future elections. That concludes this month's report for programs. Deputy Martin will provide the healthcare services update.
Good evening, Board. For the medication assisted treatment and substance use disorders for the month of October, 20 individuals prescribed naltrexone, 1 individual received Vivitrol prior to release, 376 individuals with Suboxone, 50 individuals with Sublocade, 58 individuals with Brixadi, 62 individuals with methadone. For Torrance commitments and admissions, 4 patients were admitted and transferred, 7 patients were committed, 3 had their commitment rescinded due to clinical stabilization, 30 are currently awaiting admission with the longest waiting since July. For Tier 4 and 5 mental health data, 0 individuals were identified as Tier 5, 28 individuals identified as Tier 4. For reporting in the queues, medical, sick call request, 44, longest waiting for 2 days. SCR mental health, 27, longest waiting 2 days. SCR dentals, 10, longest waiting 1 day. Psychiatrist appointments, 400, longest waiting 12 days. Mental health specialist, 7, longest waiting 3 days. For the sick call completions for the month of October, for the SCR dentals, 244 visits were completed. SCR medical, 1,263 were completed. SCR mental health, 367 visits. Medical providers, 1,334. Psychiatrists, 1,285 visits were completed. For updates from last month's GOB, GOB had asked to be appraised when a policy had been updated or revised. For policy number 2109, procedure and event of an inmate death, it became effective September 2015, revised again in 18, reviewed in 19, 21 and 22, then revised again in October of 23, and again in April of 24. For the tier data, it was asked about the tablets. Tiers 1, 2, and 3 are allowed to have tablets when they're out of their cell. An update on the status related to mental health hiring and programming regarding recent settlements. We have successfully filled all 8 therapist positions and all 9 mental health RN positions. Mental health therapy has started 5 days a week, and programming has started on a mental health pods provided by the RN. Pleased to announce that 2 of our mental health administration team members were able to attend the NCCHD conference this past month in Las Vegas, and they were able to bring back valuable materials for review. For the question regarding our intake updates regarding prior NCCHD visits. Approximately a year ago, many improvements were made in the intake department. Several are listed. Urine drug screens on all new arrests. This provides earlier identification of potential withdrawal. Increased referral to the courts for medically vulnerable arrestees. Initiated a tracking board system to increase communication and centralize data for arrestees that need follow-up monitoring. Use of colored armbands to identify arrestees with medical and/or detox needs. Added emergency equipment in multiple areas in the intake process. Reviewed and updated substance use, the CERN team, substance use recovery nurses, updated their roles. We hired a full complement of 14. The goal was to have 6. increasing communication between all entities for access to patient needs, use of hydration for detoxing population via water and Gatorade, and then starting next week, we will have a new receiving room area that will be operational to provide a private area for assessments and questionings. We are continuing to work on the goal of having 24-hour aid-on coverage to provide support to staff and patients, and a generalized space to hold similar patients in one location for monitoring processes. Lastly, as Acting Warden Dady mentioned, ACJ did participate in the NCC HC accreditation survey the last week of October. I am proud of the work of the staff, both corrections and medical, that they do every day in a complex environment. We were able to have an ending meeting with the survey team, and they mentioned that the institution shows passion, and the camaraderie between medical and corrections is impressive. Enthusiastic staff, and they were very impressed overall. The surveyors reviewed policies and practices, comparing them to the 57 standards and 376 indicators provided by NCCHD. They talked to all the staff in the building, both medical and corrections, and the incarcerated individuals. It will take a few months for us to get the report back from NCCHD team to know a final response. This concludes the healthcare report.
Okay. Questions? Warden, I'd like to say that it's been a pleasure to work with you, and we will be very sorry to see you go. Been a real benefit to Allegheny County, so thank you for your service. And good luck in your
Thank you.
future endeavors. Questions?
I have a whole bunch, but I didn't want to go first.
I just have like a couple. The federal holds that you mentioned, are any of those ICE immigration holds? No. Okay, good. I had a question about the hunger strike. Who was talking about that? I think you said how many days?
13 meals.
How many meals?
13 meals.
Okay, 13 meals.
Correct.
But that person can get water and other things during that time if they choose to?
Once they're placed on our protocol, the food and the water intake is monitored by the healthcare department.
Okay, they have it available to them.
Yes.
And did that person have to get any medical treatment during that time? 13.
Did they have to go out
Get
for
medical, yeah, get medical treatment for
No.
the effects. Okay.
No.
And then I just had a question about the Trinity takeout. So that food is prepared at the kitchen at the jail, or?
Correct.
Okay.
So it's not like they're getting, they don't get like Chick-fil-A or
It's not
something like
McDonald's,
that.
no.
Okay. All right, that's all I have for now.
Ms. Hallam?
Yeah, sure. All right, Warden, I will also start off by saying you are the best warden I have been on this board under, and it's not even close. So, yeah, thank you. Okay, I have a couple questions. The first one is, I'm just going to go just because Barbara just asked about the hunger strike. I thought when we talked about hunger strikes in the past that they were limited in their water that they were able to get because you were worried about overwatering or something?
So they don't have free range to the water, like it's not in their cell, but they are offered water frequently by the healthcare staff so we can monitor what their actual intake is. So if you give them an 8-ounce cup of water and they drink it, we can mark down that they've drank all 8 ounces. So it
Okay.
is offered frequently.
Okay. My next question is about, since you are leaving, Warden, like, can we just talk about what's the succession plan? Like, who's going to sit in that seat next month? I'm on the Warden Search Committee. I know that there are no finalists, yet. And so I'm just wondering, like, when you leave, what happens that very next day?
I believe Chief Beeson and the other deputies will be able to fill the warden's place until one is selected. That's what will happen.
So, like, Beeson will be interim warden? I mean, will that be your actual title?
We're still waiting for direction from the manager's office on what's going to happen when Warden Dady is
Right.
done.
Okay, so the answer is we don't know yet what happens when you leave.
But we are planning.
We're planning. We're talking about it. We
Yes.
just don't know yet.
Yes.
Okay.
And we will, I will ensure that the manager's office does provide a memo to the Jail Oversight Board so that you all are aware of who is running the jail
That's really
while
what I
we
wanna know.
while we select a new warden.
Okay.
Thank you.
Cool, thank you. I'm excited about all of the changes that are happening. The next question I have is about somebody that submitted an online public comment about the uploading the receipt and a delay. I'm sure you guys all saw this comment as well. Basically, it says, the book policy was changed. We've talked about this many times over the years. And so it says, the book was ordered on 9/21, arrived at the ACJ on 9/30. The senders are required to upload the receipt online. They did that the same day it arrived at the ACJ on 9/30. And as of, October 10th, which was 10 days later, it was still in the mailroom. Now, I know that this was old, it was right after the last meeting, but I was just wondering if you could talk about what that delay is between when someone uploads the receipt and when the incarcerated individual actually gets the book.
So I investigated that complaint today once I saw it. That individual did receive the book on October 10th. So the same day she submitted the complaint, it was delivered. So the process was changed a year ago where any receipts are submitted online, and that enables the family to have a tracking mechanism for when the book's received and delivered. The book was received to the jail on September 30th. It was logged and categorized to be distributed. It was delivered to the caseworker team on October 8th, and the caseworkers delivered it on the 10th. So we are looking at where we can make process improvement to get those delivered a little faster, because we too agree that a week is a little long for it to sit in the mailroom if that's what happened. But I am still in the process of talking with people to figure out exactly what happened in that particular instance.
Okay, yeah, I would love to know that after, maybe at the next meeting we could talk about that, or any changes you made. Because so it was basically like getting from the mailroom to the caseworkers where we were really seeing the bottleneck. So I'd just love to know about that. My next question is about, you mentioned tracking, and I think that was when we were talking about trying to track data of people coming in who maybe had some health issues, like whether they should be rejected from even coming into the jail and maybe instead sent to the hospital. So could you just talk a little bit about what that tracking looks like?
So the tracking system that we have isn't like to mark anybody that we refused or anything like that. It's honestly, if you can picture like an ER tracking board.
No, I don't know what that is.
Okay, so it's like a board that lists like all the patients on it and what room they're in and if they've seen or like what they're waiting for. So we use this system, and it's just a spreadsheet that we use that we would put anybody on there that may need increased monitoring on their vitals. If somebody has potential for detox, anybody that's maybe a diabetic, anyone that we would have concern about throughout the intake process, that everybody in medical has access to in the intake department, so they can just jump on a computer and see where they were seen last and what they need next.
Okay, so there is still no tracking happening of when people are being brought into the jail and are not healthy enough to be admitted to the jail?
I don't remember getting asked specifically for that.
Well, that's like what we're trying to figure out is, we're trying to figure out like why people are dying in the jail, and is it because they should have never been admitted and should have been sent to the hospital in the first place? So, yeah, I'm just really interested in things that we could do to try to fix that. The next thing is you talked about urine screens on all new arrests, but I thought that always happened, but you mentioned it to make me kind of think that something had changed with it. Could you speak to that?
I'm gonna guess about a year and a half ago is when we really made the push to get everybody.
So no one comes through intake without having gotten a urine screen first?
Some people do, I don't want to say get missed, some people refuse.
Okay.
Some people, mental health wise, are just not cooperative enough to do it. But there's always that reattempts to do so. Even if they get up to the mental health pod and they stabilize a little bit, we can still reattempt to get it.
Okay, and are these instant results that you get? And how long does it take from the time, it's not right when they walk in the door, is it?
We ask for a urine as soon as you walk in the door, yes. When you get your armband on, you get asked to provide a urine.
Okay, awesome. The next question I asked is specifically around like medical procurement. So whether that's like supplies, whether it's special needs that incarcerated individuals have, or even like medication. I know we've had instances of being out of medication, who is responsible for doing medical procurement? It doesn't even need to be a name, a position that the person
Sure.
has.
So we do have a supply clerk,
Okay.
and we also have a clinic manager that they work together to handle all of that.
And are those like licensed medical professionals?
No.
Neither of them, okay. Okay, how long does it take? Like, say an individual comes in and they need a medication that you don't carry, or they need a medical device that you don't have in stock. Is it within 24 hours? Is it within a week? How long can they expect to have that in the jail?
So I mean, I guess it would be depending on what it is. We have multiple different vendors that we use. Desperate-wise, we can always Amazon something, for a device if we need it, but I would say no more than a week, depending on where we have to order it from. For a device-wise.
For a device, and then-
Medication-wise, specialty meds, again, we can always reach out to the family. If it's a really special medication, like a chemo med or something, we can reach out to family. But we also have other vendors we can use for medications.
Okay, and do you have a specific pharmacy that you contract with?
Yeah, we use Kane Pharmacy.
Okay, Kane. And how soon will it be between like putting in an order to them and actually getting a medication in stock at the jail?
So we do have a really large stock item of medications, but then some medications do come patient-specific. We get deliveries twice a day from them.
Twice a day, okay, thank you. My next question, you mentioned the mental health therapist. I'm so excited about that, by the way, that we hired therapists, hired the mental health nurses. I think that is a long time coming. So who gets the therapy? Like who?
So there is a list of criteria. I
you
will
give-
be glad to bring that for you next
Yeah,
time.
please.
Yeah, I can bring that for you next time.
Okay, and then aside from like that specific criteria, is it any pod?
Yeah.
Any pod, okay. And then if someone needs that, because I think, for example, we reported on that in our last inspection, like somebody really needed therapy really
Right.
badly, how can they go about asking for it?
So there is a referral process that they can use, but they can honestly submit a sick call slip to mental health,
They could, okay.
and then we can put them through that referral process.
Okay, so everybody does have to be referred by someone else before they get to speak
Right,
to a therapist.
yeah.
You can't sick call and then get an
Yeah,
appointment with a
right, correct.
therapist? Okay, who is that first line that they would be seen by then? Like, who would evaluate
So
if they
if
need
they
it?
just put in a mental health sick call, either a mental health nurse or mental health specialist would go and see what they need, and then they can go through the process.
Okay. The next thing is, I know a lot of programming is dependent upon classifications of incarcerated individuals. So how often are those classifications reviewed to determine if someone should be a different classification than they came in on?
The initial review is within the first 30 days, and then I believe it's every 90 days after that.
Okay. And who conducts that classification review?
The classification department.
Are those folks, is that like a committee of people, or is that like their whole job is the classification department?
So we have a sergeant that oversees that department, and then corrections officers have specific training to work in that department.
Okay. My next question is, I was wondering if maybe at the next meeting or the next one, we could have the HR director come here and just talk about efforts that they're doing to recruit staff? Is that something, or person we could bring to talk about that?
So I can
Is it
provide.
you? Are you the HR?
No, I'm not the
person?
HR
Oh,
director,
okay.
but I can provide the information from our talent acquisition specialist of what all the efforts are, so I can send that to the board ahead of that meeting, so you guys can see that and ask questions at the next one.
Okay, and they would be here to answer those questions?
I will speak with them.
Okay, yeah, I would really appreciate that. It seems like we're making some headway in the mental health department. I just kind of like see that everywhere else. I only have a couple more. Oh, my next question is about, I know lately it seems that we have been seeing some like concentrated complaints about specific corrections officers or sergeants. And something that I was talking to a corrections officer from another local jail, and he was suggesting like when you have a specific person who you're having issues with, like moving them to another pod and seeing if the complaints continue on that other pod. Like, is it the people on this pod, or is it the officer and it's following him everywhere? Is that something we do, or do you have, can I ask that we try that?
So we have a process of investigation. I can't get into it because of personnel issues, okay? But if we receive a complaint about a specific employee, let's say, it's not just limited to corrections officers.
Right.
That's looked into, and if there's credibility found to it, that person would be moved to a different location.
Okay, it's just that I have like heard of investigations happening and they always seem to be unfounded, but yet I hear like pretty credible sounding complaints that are pretty consistent amongst different people and pretty specific as well. And so I'm just wondering, like, what does it hurt to just try it, you know?
So if we receive a complaint, specifically like sexual misconduct or something like that, that person would be moved pending the outcome of the investigation.
What about just someone who's like a jerk to people? You know,
We'll
like,
look into it. I mean, you have to understand complaints regarding how somebody spoke to somebody are very hard to confirm
Yeah.
or deny because we don't have recordings of those.
right, that's why I mean, why can't we, since we can't prove it?
Well, because the corrections officers, they pick their work locations based on their seniority, so
They
that's
pick-
governed by the CBA.
Okay.
Right.
Okay, and so if they're picked by seniority, like there is no, oh, well, you can't go to that pod. Like there's no vetoing what they pick after they pick by seniority?
Well, like I said, there are specific investigations where we would invoke that, but as a general rule, they go where their seniority can hold.
Okay, and so different pods require different seniority levels?
No.
Okay, it's just that you get first steps. You were just saying where their seniority holds, and I was wondering what that meant.
I mean, based on where their seniority is, if they have better seniority than somebody else and they want to work a particular area, they would go there before that other person. And then that other person would get to pick before the next one in line, if that makes sense.
Yeah, sure. And, okay. So how long are they at that location? Like, how often are there reviews and repicks, I guess would be the way to ask that.
They can hold a bid as long as they want to.
Oh, okay. And what is, criteria to determine reviewing, should that person still be holding that bid?
It depends on what the complaint is.
Okay, so like, for example, when we or, members of the board or the liaison or someone submits a report, hey, I've been getting lots of complaints about this person, is that not enough to trigger, maybe let's try and move them and see?
No.
And that's because it's prohibited by the CBA?
No. We'll initiate an investigation, and if the information that we're getting back seems like there's some credibility to it, then we'll move on to the next step.
Okay, and what determines credibility?
The information that we get back based on the investigation.
Okay, I mean, is it quantity? Is it quality?
Like I said, there's so many different scenarios as to what the complaint could be.
Okay, okay, all right. Move on to the next thing. My next question is about, I was talking to somebody who was part of he worked at the jail for a very long time. He did like the move from the old jail to the new jail and was just talking about the differences amongst the jails. And I was asking him specifically about, I'm on the lockdown use of force committee, very concerned about what seems to be a lot of lockdowns, especially at specific times of the day, knowing that it's because we're short-staffed. And he was saying that was the whole intention of building the jail the way it is with the pods instead of like the long blocks, was so that if there was an incident on one pod, it wouldn't lead to an institutional lockdown because they're so segregated. And in addition, there's always at least one guard on pod at any given time, and they never miss lunch. There's always relief for lunch. So why is it that staffing issues are causing lockdowns, I guess would be my question.
Well, you're assuming that there's nothing happening in the jail during the day that requires a response, right? We always have a corrections officer on the housing units, but if we have a disturbance, we have altercation, then we have to have the appropriate number of staff to respond to handle that appropriately, right?
Right. And I do know that, which is why you have the CERT team, right? Or the crew or whatever it is that we call it now. And so we have a whole team of dedicated people who are not housed on specific pods for the purpose of that response, right?
Okay. We have 30 housing units that are open right now.
Right.
Okay.
So is your theory, if people were out on rec, the CERT team could be needed on 10 housing units all at once and they couldn't?
It's always a possibility, yes.
But is it a possibility that justifies locking down pods?
Yes.
Okay, now are lunch breaks for the corrections officers ever missed because of These staffing issues?
Sometimes they are. Sometimes they're limited in duration, yes. We've had to limit them to half-hour lunches. Sometimes they are missed because we just don't have the staff to relieve them.
So there are times where corrections officers are working, I mean, we've heard many times now they're working sometimes double shifts and not getting a lunch break?
It's a very rare occasion, but it has happened, yes.
Okay. And then what about, the institutional lockdowns? There's an issue on one
You're
club.
on the lockdown committee. May I suggest that you delve into this issue as a committee member instead of conducting an investigation during our public meeting?
That's actually why I'm asking the questions, because I'm on the lockdown committee.
Yeah, you should ask it
Publicly.
during a committee. No, you should have a meeting with the jail and ask your questions, and you can come back and report to us. But we're not conducting your subcommittee meeting right now.
No, I know, we're in the public meeting, and I just have questions for the administration that
You should delve into as a subcommittee member.
I think I can do both, though, right?
Well, no, I mean, I'm going to ask you to move on and take care of this on your subcommittee. I heard that you didn't have a subcommittee meeting this whole month.
Do you know why?
I have no idea why,
Okay.
but that's when you should be delving into these particular questions.
But unlike other legislative committees, our committee meetings are not public, and I think when members of the public are specifically bringing issues to my attention, that I should answer them in the public
Yes, you should
setting.
answer them, and then you can report to us. But you shouldn't be conducting your investigation in the public meeting.
So what questions should be asked in this public
Okay.
meeting? No, really?
Not all your detailed questions about shifts and lunch breaks and who does this and who does that. You want detailed information, right? So you should go down to the jail and meet with them and get the answers to your questions.
Okay, what questions should be
Okay,
asked about in this public
What's
meeting?
your next question? I'm not going to engage in a cross-examination.
No, this isn't a cross-examination. I just really want to know so that I can ask the appropriate questions.
I think that you should report during old business, report what you found after having investigated these issues that arose with jail administration. You can report to the public meeting. These are the results. This is what we looked into this month. Here's what we found. I have an issue with A, B, and C.
Right.
Not finding out what your issues are at this meeting.
But these are questions that also have come out of our committee meetings. We have had committee meetings and we have talked about these
And
things.
so you should get the answers during your subcommittee meetings.
So what questions?
Okay, what is your next question? I'm not.
That is my last question is what topics should I be asking questions about in these committee meetings? If it's not
don't know.
employee
You're on the
welfare,
subcommittee.
incarcerated individuals' welfare, health care,
These
or
questions that you're
lockdowns.
asking right now.
Yes.
You should be asking during your subcommittee meeting. This whole line of questions that you just engaged
Judge,
in.
I understand that. I'm just asking for an answer to my question. What questions, if not things that are covered under topics of subcommittees, should I be asking in this meeting?
I don't know, whatever you want to ask.
This is what I want to ask, though, and you're telling me I
Okay.
can't. Anyways, I have no further questions. I will pass it on to my esteemed colleague, Manny.
Not very esteemed, but anyways. Again, echoing what was said already, I want to give you your props. You know what I'm saying? Of course, you were a lot better than the last warden. And to be fair, I typically don't have a lot of good things to say about the jail administration and staff. But I remember you stopping by one of our jail tables on a Friday and having like a very, very in-depth conversation with Bethany and, listening intently. And I appreciate that respect. And I like to give credit where it's due. So thank you for your service. My next questions are related to some recent reports that I received about religious meetings. I know like some of these were already brought to your attention, but I'm hoping that you can answer some publicly. They said that the Buddhists were not permitted to meet. Is there a specific reason why?
So these issues were brought to my attention right before this meeting. These are issues that we need to look into and investigate. I was told that there's an issue with Buddhists not being called down for their meetings and Muslim services being interrupted. So those are two items that we're going to investigate and make sure it gets corrected.
I appreciate that. And whenever you're finished investigating, can you please provide the board with an update? All right, thank you. My next issue is, again, like with the use of force incidents, just going off of this report, you list the use of force by location, and again, which seems to be the trend, the use of force incidents and the intake far exceed every other location. Is there any steps that are currently being, taken, or any steps being taken to address this? I think it was a couple months ago that y'all mentioned y'all were doing some type of like renovation within the intake, or like planning on, trying to improve it in some way, somehow. And of course, I understand because it's intake, folks are being introduced to the jail structure maybe for the first time. So there are some like failures to comply and stuff like that. But is there anything being done to address the use of force in the intake?
So the renovations you mentioned were what Deputy Martin touched on as far as healthcare services, the more in-depth review of everybody coming into the jail at an earlier point in time. As far as the use of force goes, most of those are because people are coming in under the influence of alcohol, drugs, whatever it may be, and like you said, non-compliance to orders, and that's why you see far more incidents of use of force in the intake department.
All right, so for example, if somebody comes in then, under the influence of drugs or alcohol, are they given an opportunity to relax or detox, or are they like immediately being ordered from one room to another?
So the jail staff receive the commitment from the committing police agency, whoever that may be. Before we can put them into a holding cell, we need to make sure they don't have anything on them that they can hurt themselves with or anybody else. So there's a pat-down completed, and then they're taken into the intake department where they're seen by the ASAP officer and Deputy Martin's healthcare team. So before they get to go in and relax, as you say, we still have to, there's still several steps that have to be completed before that can happen.
So there could be like uses of force incidents during that like initial contact?
That's where most of them are, right in the Sallyport area.
Oh, that's interesting.
Yeah.
Yeah, every time I think of intake, I think of, sitting in a bullpen for a few days. So I didn't necessarily consider that initial Sallyport entrance. You're saying that's where most of the issues are taking place?
Yep.
Maybe that's something that we can look into. All right, I got you. Another question about that, on one of these incidents, it says 8:31 a.m., there's a planned and unplanned use of force, which kind of confuses me because I thought it was either one or the other. Is there anything that you can elaborate on in that regard?
I don't know the specifics on it. I'd have to look into it.
Find out in our committee.
I got you. All right. Yeah, maybe I'll just make a special note of that. I guess my other questions are about updates. Again, as you know, because I gave you credit for stopping by the jail table, I noticed the door is still broken, the front door. Has there been any updates on when that's going to be addressed?
It was literally just fixed today.
Really?
Yes.
Oh, wow. What are the odds? Also, yeah, I know, right? Also, I'm not the best with email, so sorry if I missed this. Has there been any updates to the board regarding the person who recently passed away? I know there was some issue with, y'all not being able or willing to share information, but pending your investigation or reports or whatever, has there been any updates?
So Board Member Perkins reached out to us to conduct a meeting with the health board, so we're still waiting to be notified to have that meeting, since it will be addressing HIPAA-related information that we would usually do that as an executive session. So we're just waiting to hear from the board as to the scheduled time for that. But otherwise, we're conducting our administrative reviews, our clinical mortality review is completed, and we're just waiting to share that information when a meeting's scheduled.
Okay, thank you.
Anybody else? Ms. Innamorato?
Thanks, President Judge. Warden Danny, thank you again for stepping in and fulfilling the role of warden during your time here. I know it hasn't been easy, and me coming in at the beginning of the year. I appreciate you and your team stepping up and really helping us get more information out to the public and to do a lot of education with the public and with the Jail Oversight Board. So very much appreciate your leadership, and I think you've set the groundwork for continued progress and change at that facility and brought a sense of calm to the work that we're doing here. So thank you for that, and thank you for the team for supporting him in this time. Deputy Martin, I want to say thank you for the work that you did in order to get the therapists and mental and behavioral health specialists hired up. I actually ran into someone earlier this week who filled one of those positions, and she was very enthusiastic about that work. And it sounds like you also did it in record time, and wanted to know if you wanted to speak to the approach that you took in order to rapidly fill those positions that are desperately needed at the jail.
So I'm actually not going to take any credit for it at all. I am going to put all the credit to our Director of Mental Health. I don't know how she did it, but she started recruiting and interviewing, and next thing you know, we were up to 8.
That's great.
Yep.
That's wonderful to hear, and glad that we were able to fulfill
Yeah, it's been wonderful.
that promise to the community that we made. So thank you. And congrats on the work that we did around the elections. And I know we had a lot of work with community volunteers to get folks registered, but it was really nice to see a well-oiled machine at the ACJ, ensuring that everyone who wanted to exercise their right to vote had an opportunity to do so. And congratulations for being highlighted on the national stage for that work. So that's all I want to say. So thank you.
Okay.
Oh,
Allen.
sorry. Sorry, before you go. I feel like I owe the public a little bit of an update, given Warden Dady's departure. So we will issue a memo to the Jail Oversight Board from the manager's office just on how administration will work moving forward until we have a permanent warden in place. Many of you who participate in these meetings, I'm sure, have been contacted by Kenyatta from Polyhire to provide feedback and insight. That community engagement process was taken very seriously and really informed the candidates that were recruited and invited to apply. There is a group of candidates that are being considered and will be brought to the selection committee, of which Councilperson Hallam is a part of in the next few weeks to have interviews and have hopefully a warden selected shortly after those interviews begin. But in the next few weeks, those final individuals who are selected to be interviewed will be made public, and they will begin the process.
Thank you. Ms. Hallam?
Yeah, I just have one thing, not about uses of force or lockdowns. So it was mentioned that there is no ICE detainers, but I know for a fact of at least one person who's being held in the ACJ on an ICE detainer right now. So I'm just wondering I'm sure there's more. I'm just wondering what the disconnect is there.
So anybody held in the Allegheny County Jail is not held on an ICE detainer. We may have an ICE detainer present in their intake folder, but they're being held on either Commonwealth, state charges, federal charges, something like that. Nobody is held in there on solely an ICE detainer.
But what about someone who, maybe got ROR and then was detained simply because of their ICE detainer? Would you not count that as being detained on an ICE detainer because pretrial services made that decision?
I'm not understanding the scenario you're describing.
For example, the only reason the person is detained is because of an ICE detainer. But the reason that they were detained was because they had the ICE detainer, but then county pretrial detained them too. Do you know what I mean?
No.
Okay, you go in front of the courts, you get ROR. Pretrial services then says, actually, you don't get ROR because you have an ICE detainer, we're going to detain you. Would you not count that person as being detained on an ICE detainer?
Do you have an individual you could give me the name of after this?
Yeah, after the meeting, I can definitely give you a name, but I'm just wondering, I only know of one name, and I'm just there could be more. And so I'm just trying to ask a general question of, if the only reason pretrial is recommending detention is because of a separate ICE detainer, in your records, would that not count to you as being detained because of an ICE detainer?
It should not, no.
Right. So even though that is the only reason they're detained.
Well, yeah, I'd appreciate the name if.
No, I know
give it
that
To me, so we
for a
can.
fact. Yeah.
Okay, we'll get the name.
Okay. Can we talk about it after the meeting and then maybe follow up? Okay, thank you.
Okay, thank you, everybody. Public comment at Addie Lord.
Good evening, everyone. My name is Addie Lord. I am here on behalf of the Project for Responsive Democracy. And I wanted to talk a little bit about the emergency operations plan as it relates to the county jail. So in light of watching Hurricanes Helene and Milton a couple months, well, 6 weeks ago, it's a long 6 weeks, in Florida and North Carolina, and seeing that incarcerated individuals were not included in evacuation plans, which broke my heart, knowing how scary it can be to be facing a storm or anything else with having agency and without that agency. It made me very concerned. So in reading through the county's emergency operations plan, which I think was signed by Executive Innamorato in January, just in terms of review. It says that the county elected officials are responsible for the protection of lives and property of the citizens, and they exercise the ultimate control of the emergency activities within the county. And there's not one mention of what will happen to people incarcerated in the jail. There's light mentions of people who are institutionalized, but not specifically them. It also says that in following a disaster, the immediate operations are to save lives, protect property, and meet basic needs. And I just want to make sure that our operations plan includes the people who are in the jail at that time. And I think it's also important to keep in mind that that's beyond just evacuations. It would also include things like if plumbing fails, which I think is one of the stories I heard of North Carolina, if there's any issues with the heating and cooling systems, knowing that that can be a problem, electricity, or even getting clean water. So making sure that everybody's basic needs are being met. And for us, most recently, that's going to be looking at a pandemic or epidemic. So making sure that we are keeping those in mind too in terms of our emergency procedures. So I think the questions that I had were, do you have a copy of any standard operating procedure or emergency procedures from the jail? I think they're supposed to have them on file according to the emergency operations plan. And then also I was curious if contractors with the jail are required to have a similar plan that we're aware of as a part of our contracting procedures. And I just wanted to say one thing, knowing that there are children housed in the jail, especially the idea of any minor facing something of a disaster and not knowing whether they can go with their family or not, or someone that they know, breaks my heart. So I would hope you look at that. Thank you.
I wrote a few questions down in my phone. First thing, this is for the Allegheny County Jail, the RHU unit specifically. I want to know why inmates are being denied phone calls. Also, if they are given phone calls, it's allowed during their law library time. And I thought law library was for the inmates to research their cases and not to make phone calls to loved ones. Laundry also hasn't been done in almost 4 months that I know of. Dirty laundry is actually being stored outside the inmates' rooms with hygiene. Also, hygiene products are not available to the inmates at any given time. I'm not sure when they're provided, but I was told that the hygiene and the laundry is being stored together outside the rooms. And also, why are there inmates on AC, but they're not being given AC privileges? These inmates are on AE and they are on AC, but they're not given any of their AC privileges. Another thing I wanted to address was the mail. There was multiple letters being sent out to me that I never received, so I wanted to see what the process was for the outgoing mail. And that's about it.
Thank you.
You're welcome.
Mary and Dan? Let's go. Hold on. Working. One second, where's my pen? Yep. Sorry. My pen was. Okay. I'm okay. Go. I'm not going right for it. Okay. First, I'm very sorry I missed the last meeting. It was a religious holiday, and I did think that took precedent. However, okay, but I'm trying here, remember, to look at things from a favorable attitude, a little difficult. One thing I would like to know is anybody at all has made any attempt to look at the county, the jail, not the county, the state jail that is open and is available. If we have to spend tax money, but it would be a better facility. It would be much easier for the workers, the employees to work, and certainly much easier for the inmates. Now, I noticed that the inmate thing, it has improved. They're not as bad as last year, month. Good gracious, time goes by. But last month, there was a lot of resistance and a lot of, should I say, fighting? That's been reduced a bit, and as I see in the report this time, and I think it's mainly when someone enters that there is a dispute, physical. My suggestion is some concern of that to try and see what could make that possibly easier. I can admit, here you are, a person under arrest, having to go shoved into the jail. Nobody wants that. And frankly, I don't think the people in the jail want it either. However, something should be done so that the incidents, and there are more than a few, of rebellion do not occur. Some a psychiatrist to ask why or how something could be done that would make it less argumentative, let's say, when you are being arrested and taken to jail. That would ease things, for one, on the inmate, and ease things on the employees, which I think is what you really should be concerned with also, how the employees feel as they're working, which brings up about overtime. One thing is, Time is up, Ms. Dam.
I'm sorry?
Your time is up.
Yeah, my time's up. Okay, but you ought to look at overtime and what's going on with that.
Okay. See you later, or next year, or next, whatever, next month.
John, you knew you were next. I got most of it.
John Kenstowicz, Kenstowicz. Staffing crisis, gun qualification test, and lockdowns. Our correctional officers carry a firearm when accompanying a resident on a hospital run. It is a major stressor for many of our officers to pass the gun qualification test. Officers are terminated for failure to pass the test. For first-year recruits who do not have experience firing a gun and are working 80 hours in 5 days, passing the gun qualification test becomes a very daunting task. Besides being physically and emotionally exhausted from working 5 double shifts in a row, the new recruit has to find the time and spend their own money in getting practice at a firing range to pass the test. At Range USA Robinson Township, anyone using their practice range has to purchase their own gun before using the firing range, a major cost. Most officers never go on hospital runs. Why should a first-year recruit who is already working 80 hours in a week and is exhausted, why can't the test be postponed until the second or third year when the officer would not be working these 80-hour work weeks? For every officer who is fired for a failure to pass the gun qualification test, the officer's working hours immediately go into the overtime hours other officers have to work. A consequence of the staffing crisis and a lack of officers to do hospital runs is that the residents suffer with a partial lockdown because officers are pulled from other positions to go on these hospital runs. Some officers who are carrying a gun on hospital runs are working 5 double shifts and even have to stay at the jail starting a third shift. What are the criminal and civil liabilities if an officer inappropriately uses a gun because of being physically and emotionally exhausted working all this overtime? In a recent incident, a resident tried to take an officer's gun on a hospital run. At last Wednesday's budget hearing, there were a lot of public comments concerning housing and the Public Defender's Office, which was positive. There was no one advocating for improvement in the living and working conditions at our jail except for me. Are our public defenders working 80 hours a week in 5 days in a job they could be hurt? Continuing to project a lack of staffing on abuse of FMLA is becoming a broken record. The stark reality is that many families of our correctional officers are being left out in the cold, and it is fiscally irresponsible and morally wrong for families and officers to be suffering this way. Our county executive could be wise and get much more buy-in on her budget from more conservative taxpayers and county council members if she said that she would be using part of the additional tax revenue. I just want to finish this sentence, okay? If she would be using part of the additional tax revenue for family and safety, keeping our correctional officers' families together, and giving officers a realistic opportunity to provide safety to our residents, healthcare staff, and themselves.
Thank you. Sarah Bosco.
Hello again. During my last visit in July, I spoke to you all about a small portion about what my life is like being the spouse of an officer at the ACJ. Mainly what it's like being the married single mom due to the outrageous amount of overtime the officers are expected to work. And I know some of you may be sitting there thinking to yourselves, why should we be listening to this woman yet again cry the blues? It could just be the 25 years that I have spent as the family member of a corrections officer, whether it be in the state or county system. I have seen all the changes an officer goes through, mental, physical, emotional, all of them. The good, the bad, and all the incredibly ugly. I've been on the receiving end of a phone call from my own officer as his body began to shut down from a diabetic complications unknowingly. Driving home from a double shift, he was forced to work, not knowing what to do because he couldn't see. He was losing his vision, scared because he didn't know where he was at. By the time he made it home, because his pride would not allow him to pull over and accept there was something actually wrong with him. And I was actually able to get him to the nearest hospital. We found out his sugar was at 466, and his A1C was at an 11. For anyone sitting here who knows anything about diabetics, you know those numbers aren't good. And it's a miracle nothing more severe happened. When my officer began his career at the ACJ, he was healthy, completely. Now, 5 years later, with the inability to properly care for himself due to the excessive and still extremely negligent amounts of overtime that he is expected to work, his health has drastically changed. I'm no expert, but I'm pretty sure that even my 5-year-old can make the connection that the amount of overtime his daddy is forced to work is partly to blame for his medical issues. The overtime has progressively gotten worse with each passing year, to the point that FMLA was needed to ensure that he was able to, at the very least, keep up with the needed medical appointments that he needs to maintain his health at a level most of you would consider subpar. My officer stays and does more than his fair share of the overtime, most times escorting an inmate out to a medical appointment. Talk about irony, right? All while handling a firearm and being
Your
excused.
time is up, I'm sorry.
That's fine.
Thank you. Alan Gunther.
Hi, I'm with the Pittsburgh Quakers and the Peace is Possible Coalition. And I just want to say that during the last JOB meeting, Dave Swanson of PIN mentioned that The Nation, which is a respected national investigative magazine, reported that the Allegheny County Jail had one of the highest probation detainer rates in the country. That's a serious problem for the people in your care. It means that dozens of people are being kept in the jail much longer than they should be. If we could reduce the jail population, many of the problems, including forced overtime for the COs, could be relieved. So I'm asking if you would be interested in looking at what other county jails do in the country. You might consider asking about their probation detainer rates and how your jail compares. Brian Lovins, who is a past president of the American Probation and Parole Association, made a presentation to our Pittsburgh Peace is Possible Coalition about probation and detainer policies around the country. And I'm sure he would be happy to give you guidance to improve your policies here. He's a respected researcher, and he is with the American Probation and Parole Association. He might give you some ideas about what you could do here. Thank you very much.
I just want to comment to you, sir.
Sure.
The JOB can't do anything about the detainers because the detainers are the judge. The judge in any given case issues a detainer, and it's up to the judge to lift or transfer the detainer. and the Jail Oversight Board has no control over it.
Well, you don't
so
have
you know.
control over it, and I appreciate your comment, but one of your members, Judge Bigley, was named in the magazine article as being one of the judges with one of the worst detainer rates in the country. So it's something that, although you may not be able to control it, you might be able to work with one of your members to improve things.
That is her capacity as a judge, not a JOB member. I just am stressing that because it's every individual judge, it's in their discretion, just so you understand that.
I really did, Ellen, though, appreciate the tie-in to the fact that if we didn't hold so many people on detainers, we wouldn't have such a staffing crisis right now. So I really did appreciate that correlation.
I'm not disputing your point.
Okay.
I'm not disputing your point at all. Okay, I'm just saying that the JOB, we don't really have any control over that. That's all I'm
although
saying.
you
And I
could-
hear your counterpoint.
Okay.
Because I'm a judge too, so, you know, I understand what you're saying, and we could, but that's in a different capacity.
Okay.
Okay?
All right. Thank you.
All right, thank you. Sharon Bonavoglia.
I do need to start by thanking Alan because it was the president of PIN, Dave Swanson, who came and spoke. And I also appreciate that it is in a different realm. Judges are judging, and then there are two judges that sit on this JOB board. And I would hope that there is enough congeniality among the judges that conversations could start, and that they might start with the recommendation from Alan to get that person in to talk to the JOB and maybe to the judges, and the president judge might have some control over that. I also want to thank Warden Dady for your willingness to meet with representatives from PIN and other organizations, and for your commitment to improve conditions for our neighbors in the jail. I want to thank you, Manny, for bringing up the issue concerning the expression of religious practices, which is, of course, very important to the Pennsylvania Interfaith Impact Network, and to Connie Clark for your willingness and your understanding of the need to investigate that. So we thank everybody involved with that. As we enter this month of Thanksgiving, I think of the empty seats at the tables of the families who've lost loved ones since April of 2020. And I'd like all of us to be thinking of those families as we rise for the reading of the names of the dead. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastorik, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonamo, Zachary Sam, Nicole Barufi, Richard Shuba II, Terrence Clowney, and Tracy Hickey. I'm Sharon Bonavolia with PIN, B-O-N-A-V-O-G-L-I-A.
Addie Lord. Oh, did Addie Lord signed up online? I apologize. She already spoke. Tanisha Long.
All right, good evening. Tanisha Long, LONG. First, a few things. Warden Dady, I think, as other people have mentioned, we do appreciate your willingness to meet with community members, increase programming at the jail, and just genuinely be better than Warden Harper. I know that wasn't a high bar, but I do think you did your best efforts to actually do that, so we do appreciate that. So thank you for your time here. Judge Abashevich, I will say that when Bethany Hallam is asking questions, they are in the interest of the public, and we only get one meeting to get these questions answered, and a lot of these questions are submitted online, or they're submitted after she would have a subcommittee meeting, which is not open to the public. The public isn't asking for a report back, they're asking to hear from jail administration. And I don't think it's appropriate to interrupt your fellow jail oversight board members because it gives the appearance that you're more interested in expediency than transparency. So as a member of the public who appreciates having this forum, I would like her to be able to continue her questioning uninterrupted. Finally, one of the things that came up today was classification, and it was said that those classifications are being reviewed every 90 days. My question is, if those classifications can prevent somebody from engaging in programming like drug and alcohol programming, the jail's worker programming, why are we not actually doing those reviews? Because there's no reason that someone who has been in the jail for 7 months should still be considered a max incarcerated person when they've had no conduct incidents. The jail is often on lockdown. And what ends up happening is that people who do not have the ability to be pod workers or have the ability to engage in programming just sit in their cell. They decompensate. It affects their mental health. It affects their ability to become ready to re-enter society. It affects their ability to learn new job skills or to address the mental health issues or the substance abuse issues that they had. So I'm asking that those reviews actually be done. And in the case of this particular individual, I'm asking that I can speak with you after this meeting to get that done expeditiously. Thank you.
Marie Guido.
It's Maria with an A, Guido. Good evening, everyone. I just wanted to make a comment on hearing about the mental health stuff. I think that's great. That was one of the things that I was really excited about. And as a licensed clinical social worker, I know how difficult it has to be to kind of bring everything together. So props to you guys on that. So I'm here today because I want to talk about some of the discussion, some of the issues with visitation. So I think that the current policy is creating a lot of barriers for working families. There's a lack of flexibility with visitation, and I think also we have these issues with canceling visit hours within moments' notice. We know that causes more trauma, and also canceled visits mean that that incarcerated person can't have another visit for at least 14 days. So research shows, right, that the body relies on contact, right? We rely on engagement in the presence of loved ones. It is a crucial part of our ability to handle stress. When we feel safe, we're better able to handle problems peacefully because we're kind of in this active stage, right? We can think and make better decisions. Now, when people don't feel safe, when they're taken away from things, you're more likely to see disciplinary infractions, assaults, mental health crises. So allowing this more contact with loved ones, giving the people the ability to be able to co-regulate, I think that that's going to decrease a lot of these issues. I think it's going to assist us better to manage the stressors, help them manage the stressors of being incarcerated. We know that it's just traumatic, period, when it comes to incarceration. Can we do some harm reduction, right? And I think that increasing visitation and figuring out these barriers will be able to help that. Also, please remember, we're still housing juveniles. at Allegheny County Jail, and best practice states, regardless if they're charged with adult crimes or not, best practice states that it's crucial that there's family involvement with these kids that are involved in the court system. It is crucial for the rehabilitation. So if we're trying to go this new way, right, that county executive has supported, then I think we have to look at this issue. We have to, it comes down to the science of safety. I understand there's staffing issues, I get all of that, but I think we really need to look at how important visitation and that contact with loved ones and family members are. That's all. Thanks.
Thank you. Stephen Fisher.
I'm Stephen Fisher. I'm sorry I missed last month also because of religious reasons. So many good things have been said, and the time is so late. I'm going to yield my time. Thank you.
Okay, thank you. Okay, do I have a motion to approve the meeting minutes of October 3rd of '24?
So moved.
Second?
Second.
All in favor?
Aye.
Any opposed? Motion passes. And it is time to adjourn. Thank you, everybody.
Schedule next time.